overwhelming majority of all breast cancers express the estrogen receptor. They're called ER-positive breast cancers, and they're fueled to grow by estrogen. And it represents 75% of all cases. And today, 2.8 million patients are living in the U.S. with ER-positive breast cancer. And so the good news is that this subtype has a relatively good prognosis. There are good drugs that are targeted to the estrogen receptor. Tamoxifen is a drug that was introduced in the 70s, which interrupts the signaling of the receptor. SERDs degrade the receptor, and aromatase inhibitors inhibit the synthesis of estrogen. But unfortunately, tumors do devise ways to evade treatment. And when that happens, this leads to metastatic disease, where the primary tumor does move to other parts of the body. And so this brings us to a really important unmet need for these patients, because they are being treated for metastatic disease, and this often includes chemotherapy, which is a toxic therapy. But what if I told you that estrogens could be used to treat breast cancer? This is very counterintuitive, because I just told you that estrogens fuel the growth of the tumor. But in fact, prior to the introduction of tamoxifen, high-dose estrogen was effectively used, but there was very harsh side effects. So tamoxifen replaced standard of care. My laboratory, in collaboration with Dr. Greg Thatcher, who's a medicinal chemist, came up with a novel drug called TTC-352, and it's a weak estrogen, and we were trying to get at this reducing the harsh side effects. But of course, this wasn't our original goal. Our research really was a conversation over the past 10 to 15 years, and TTC emerged as a result of that dialogue. And we were lucky enough, with the help of a medical oncologist, Dr. Arv Dudek, and critical funding from an angel investor, we were able to start our company, TTC Oncology. We were able to initiate a phase 1 clinical trial in 15 patients with metastatic disease. You typically don't expect to see any kind of result in a phase 1 trial, because it's a dose escalation. But we were thrilled to see that we did have some findings, and we did have some responses from patients. This is a 49-year-old woman. She had 12 prior chemotherapeutic drugs, some of them chemo, some of them targeted therapies. She entered the trial, and she was able to have 6% tumor shrinkage, and she had stable disease for 10 months without toxic side effects. And so her husband thanked the treating oncologist for giving his wife her life back. And so we are extremely grateful to all the patients that participated in this trial, and we look forward to advancing this drug to help patients living with metastatic breast cancer. Thank you.